The Nassau County School District is a progressive institution when it comes to the health and well-being of their students and faculty. And like most school systems in Florida who deal with high humidity and heat, they have struggled with air quality. Veteran Superintendent Dr. John Ruiz has tried numerous solutions with minimal success.
Here for 22 years, and during that period of time we would have classrooms and areas in our schools where some of the employees were concerned about the air quality in their workspace or in their classroom spaces. If there's some product that we could have that would allow a process for a healthier environment to exist in our classrooms and our schools, that was certainly something that we were interested in.
The results of the study showed that mold and fungi were reduced significantly, and asthma and allergy symptoms suffered by both students and teachers dropped dramatically. Another significant finding of the study showed that feverish children with flu-like symptoms did not infect other kids, although they were in the same classroom. The teacher who noted this had never seen this occur before. It's safe to say the response to the results of this study was positive.
They seem to be a little bit healthier, feeling better, frequency of illnesses maybe not as much. I know we've had a couple of teachers too that have had some upper respiratory issues that seem to be not as pronounced, perhaps, I guess is probably a safe way to describe that, as they had been experiencing before.
As a result of the study, Dr. Ruiz decided to install HRMS units in a classroom at Fernandina Beach High School. These special needs children are especially vulnerable to illness, so the HRMS systems are ideally suited for this particular location.
Our Profound Mentally Handicapped program is a program that's designed for students with mental challenges as well as physical challenges.
They are students that are physically and mentally compromised and require a nurse to be on to take care of different aspects of their daily living.
I thought that using Ms. Phelps' class was the ideal spot. Those students in there are very medically fragile, so to have any type of airborne diseases or any type of infectious diseases can be traumatic to those kids. So having that classroom as our primary focal point was a great idea to me.
Frequently our kids are in the hospital because of immune issues and infections or whatever's going on. If the flu's out there, our kids are going to get it and they're going to be in the hospital. Who wants to be sick? I mean, they have enough issues that they deal with every single day, and it's miserable, for them. And they get it harder, and it takes longer to get rid of.
Address those who are younger and most vulnerable. If there's one common thread in all the research that I've run across in education over the years about students being successful, it's the fact that they're in attendance regularly. One, it's provide a healthier environment for the children, and then that's something that could conceivably, and based on research that I've seen, would result in increased student achievement.
This is really pretty awesome, to think that our county cares enough about us to spend the money. I mean, we're just super excited to have him.
When asked how she thinks parents will react to the addition of HRMS units to her classroom, Mary Kaywork responds,
when you see a school that's saying, we're going to try to help keep your kids healthy, I mean, what parent wouldn't love that?
In this typical classroom, the blue circles illustrate the 6-foot social distancing recommended by the CDC. Adjacent desks within the 6-foot radius need to be closed to conform to the guidelines. Of the 24-seat capacity, 12 must be closed. This represents 50% of the available seating. The CDC offers alternatives for consideration. On May 27th, the CDC updated their interim guidance for businesses and employers responding to coronavirus disease. As a part of their recommendation to improve ventilation, they suggest ultraviolet germicidal irradiation, a method of disinfection that uses short wavelength ultraviolet light, UVC, to help inactivate the virus. The CDC refers to ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, position document on airborne infectious diseases. ASHRAE recommends installing UVC fixtures on or near the ceiling to irradiate upper room air, disinfecting the air directly within the occupant's breathing zone. The fixtures are recommended when ventilation rates are low and are typically mounted at least 7 feet above the floor. The VidaShield UV24 system uses UVC light and filtration to draw in and treat environmental air. UVC has been shown to kill SARS-CoV-2, the virus that causes COVID-19. UVGI, in the form of UVC light, has been recommended or used for the isolation of disease and biodefense systems for buildings by the United States Army, the CDC, and the Federal Emergency Management Agency, FEMA.
Why not consider the air? Doctors wear masks during surgery. Dental hygienists wear them during routine procedures. There is risk of spreading C. diff from simply flushing a toilet. And well child visits account for 700,000 new cases of the flu each year, costing $500 million. UV has been used as a disinfection tool for decades in healthcare. But the challenge with UVC technology has always been the method of delivery. It can't be used in occupied spaces and is only effective in areas that are direct line of sight. Until now. That is exactly what makes VidaShield different. Operating 24/7, 365 in occupied spaces, VidaShield is a fast, continuous UVC air purification system that reduces the levels of bacteria and fungi in treated air and reduces the settling of viable bacteria and fungi on surfaces. Healthcare staff have reported improved indoor air quality and reduced odors. The patented VidaShield is an active system that draws microorganisms to a UV light. There are 2 vents on the face of the fixture. Behind one is an array of fans which draws air through a MERV 6 filter, which removes larger particulates of dust. Air is pulled through the filter into the UV chamber mounted on the back of the fixture at approximately 50 cubic feet per minute. It can treat a volume of air equivalent to a 10 by 10 by 8 foot room, 4 times per hour. The air moves through a set of safety baffles which prevent the UV light from escaping the chamber. Once in the chamber, a high-intensity UV lamp operates at the peak wavelength of 253.7 nanometers. The air is then pushed through an opposing grill at a 30-degree angle to promote circulation of the treated air throughout the room. Once VidaShield is installed, it requires no engineering controls to operate and minimal maintenance, which helps keep operational costs low. VidaShield is designed for use in hospitals, long-term care facilities, nursing homes, schools, commercial office buildings, and any other location where cleaner environmental air is desired. The energy-efficient VidaShield is available in 3 styles.
Make sure that once your facilities reopen, they remain open with VidaShield.